Hi guys, today we learned something about the facial nerve. And before starting about the facial nerve, I would like to basically tell that how to appear for this question exam. So we have to start with the definition of the nerve, then write about the nucleus which is involved, the course of that nerve, the branches which are involved. So the for the course and the branches, we have to draw the diagram which is related to it. And later on, we have to write about the facial nerve paralysis, the upper motor neuron and the lower motor neuron lesions. So we'll start off with our facial nerve. So basically, facial nerve, we have to define it. It is the seventh cranial nerve and it supplies the muscles of facial expression. This is the basic diagram of the brainstem as I've shown in earlier videos also. Above part is the midbrain, middle part is the pons, and lowermost part, this one is the medulla. The bluish part is the fourth ventricle, and this is the cerebellum. So talking about the facial nerve, it has two types of fibers, sensory fibers and motor fibers. So obviously there is nucleus which is involved. So the nucleus which is related to motor and sensory fibers, we'll talk about it. So the nucleus which is related with motor fibers, there are two types of nucleus. First is the facial nerve propen nucleus at the level of pons, and one is the superior salivatory nucleus just at the base of the pons. So this is shown in the diagram. This one at the level of pons is the propen nucleus, and the at the base of pons, below the level of pons, is superior salivatory nucleus. So talking about the motor fibers. So what happens is, I'm not talking about the facial nerve here. Facial nerve is basically an exception. I'm talking in about generally. So what happens is, in normal cases, motor fibers come out of nucleus and it follows a forward course. As I'm showing with my pointer, the motor fibers come out through the nucleus and it follows a forward course. But in facial nerve, it's the opposite. What happens is, it's an exception. So, so when the motor fibers come out when the motor fibers come out of this facial nerve propen nucleus, they follow a backward course instead of following a forward course towards the base of fourth ventricle. Now, when it strikes the base of fourth ventricle here, it leads to an elevation. Okay, so it basically leads to an elevation. So when it leads to an elevation, this elevation is called the facial folliculus. Then it follows a circular path and exits via this junction where my pointer is. This junction is called the pontomedullary junction because it is between the pons and the medulla part. Okay. So now talking about the nucleus which is involved in the sensory fibers. So this nucleus is below the level of pons, obviously in the medulla area, which is called the nucleus tractus solitarius. Now talking about the course of the facial nerve. So there are two types of fibers. One is the brachiomotor fiber and one are the parasympathetic fibers. In dono ke, we have to explain the course of both of them separately. So first we'll talk about the brachiomotor fibers and later on in the video we'll talk about the parasympathetic fibers. So this is a basic diagram. I'm briefing you about this diagram first because in both the brachiomotor fibers and parasympathetic, you will need this diagram to be drawn. This is the brainstem diagram, as we all know. This is the anterior cranial fossa, middle cranial fossa, posterior cranial fossa. The link between posterior and middle cranial fossa is led down by a canal, this bluish canal, which is called the internal auditory canal, which leads into the middle ear. This is the cubical structure, which is the middle ear, which has a roof, then it has a posterior wall and the floor. Okay, now towards the anterior cranial fossa end, there is the orbit. Above the orbit, here will be a lacrimal, at the lateral portions, you can say, lacrimal gland. Then this is the brownish structure, which is the maxilla. This part is the pterygoid plate. The space between the pterygoid plate and the maxilla is pterygopalatine fossa. Okay, so this is the basic diagram which is to be drawn. Moving on to the course of brachiomotor fibers. So what happens is cranial nerve obviously comes out of the seventh cranial nerve, which is the facial nerve, comes out of the nucleus. It follows its path. It comes into the internal auditory canal, and then before entering into the middle ear, it comes out of a ganglion which is called the geniculate ganglion. Now, this word geni has been derived from the word genu, 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 which means bend. So, because why it is called so? Because the facial nerve, from after passing through this ganglion, takes a sharp turn towards the posterior wall of the middle ear. Then it enters the while entering into the posterior wall of the middle ear, it it exits its pathway through the stylomastoid foramen. Okay, from the stylomastoid foramen. So, uh, while exiting its course, it posteriorly gives off its three branches. Also, here you can see that there is a stapedius muscle. So when the facial nerve comes post towards the posterior wall of the middle ear, it supplies the stapedius muscle. So this branch is known as nerve to stapedius muscle. And posteriorly, when it comes out through the stylomastoid foramen, so it gives off its branches like the posterior auricular, the nerve to the posterior belly of digastric, and nerve to the stylohyoid. Now, after it comes out of the foramen and gives off its those three branches, then the facial nerve heads its course towards the parotid gland, where it gives off its five terminal branches. Okay, the five terminal branches, which is the temporal, zygomatic, buccal, marginal mandibular, and cervical branches. Now I have written down the summary regarding in a flowchart manner regarding the course of sympathetic fibers, the brachiomotor fibers. Facial nerve moves into the internal auditory canal. Then from there it moves into the geniculate ganglion, where it takes a sharp bend, moves into the posterior wall of the middle ear, exits via the stylomastoid foramen, then it gives off its branches, three branches which I told you. Then it moves to the parotid gland and gives its five terminal branches. So this is the basic course of the brachiomotor fibers. Okay, now we talk about the parasympathetic fibers. Now, parasympathetic fibers are of two types, lacrimatory fibers and salivatory fibers. Okay, so what happens is facial nerve, as usual, comes into the internal auditory canal, and then uh, before entering into the middle ear from the geniculate ganglion, the sympathetic fibers go inside, uh, enter inside the geniculate ganglion and reaches the middle ear. But what happens is these parasympathetic fibers, they get deviated from its path. get deviated into salivatory and lacrimatory fibers. So they get deviated from its path before it does not enter basically into the middle ear. So it gets deviated from its path. Okay. So now talking about the course of lacrimatory fibers. First, we'll talk about lacrimatory, then about the salivatory. Uh, from internal auditory canal, the lacrimatory fibers get deviated, does not enter the middle ear. It goes into the middle cranial fossa. The nerve which goes into the middle cranial fossa, this is called the greater petrosal nerve. Then it moves into the pterygopalatine, uh, the the pterygopalatine canal. Through the pterygopalatine canal, it further comes now into the fossa, which is the pterygopalatine fossa, this space. Okay. So, pterygopalatine fossa, which is between the pterygoid plate and the maxilla. Okay. This fossa, pterygopalatine fossa, has a ganglion in it, which is called the pterygopalatine ganglion. Here, the lacrimatory fibers end. Which type of lacrimatory fibers end here? Are the preganglionic fibers. Preganglionic lacrimatory fibers end up in the pterygopalatine ganglion. But postganglionic fibers still have a path to follow. Okay, so I told you that from the pterygopalatine canal, there is a nerve which comes. This nerve is called nerve to pterygoid canal. So, nerve to pterygoid canal is also known as the Vedian nerve. So, I have just a brief about the lacrimatory fibers course through a flowchart. Enters into the middle cranial fossa, exits via the foramen lacerum, enters into the pterygoid canal, then enters into the pterygopalatine fossa. This nerve was called as Vedian nerve, which was nerve to pterygoid canal. Then fossa has a pterygopalatine ganglion. Preganglionic fibers end up here, but postganglionic fibers, they move along the course of the trigeminal nerve. Like they follow the path of ophthalmic, maxillary, and mandibular, along with the trigeminal nerve, along with the ophthalmic branch, the maxillary branch, the mandibular branch. Some of the lacrimatory fibers also move about, like with ophthalmic, the some of the lacrimatory fibers move with the ophthalmic course, with the maxillary course, out of the foramen rotundum, and from the mandibular course also. Talking about the course of the salivatory fibers. So, what happens is the salivatory fibers, uh, after coming, after entering the uh, geniculate ganglion, it comes into the middle ear, enters into the posterior wall of the middle ear, but instead of uh, following its path which was followed earlier, like going via the exiting its pathway via the stylomastoid foramen. This has an exception here. The After following its course from the geniculate ganglion, it enters posteriorly towards the middle ear, and then suddenly takes a bend and moves towards the facial canal. This canal is called the facial canal, and moves out through the pterygo tympanic fissure. And after it moves out with the pterygo from the pterygotympanic fissure, it follows its course with the lingual nerve. Lingual nerve is a branch of mandibular nerve. So, with the lingual nerve, it follows the pathway of the lingual nerve, but it does not reach up to the tongue. It basically supplies the submandibular gland and the sublingual gland. It does not reach up till the tongue. Tongue is reached down by the lingual nerve, but it reaches and supplies the submandibular gland. So this was all about the facial nerve. Hope you liked the video. Do tell about your thoughts and what you all want me to explain in my further videos. And in my upcoming videos, I'll explain about the Bell's palsy, upper motor neuron lesions, the lower motor neuron lesions, the facial palsies. So stay tuned for the upcoming videos and press the bell icon. Do like and subscribe my channel. Do share my videos. Thank you. Have a nice day.